Hey, Dr. McNamara here at McLaughlin Care, and Carly here is going to help show what a chiropractic adjustment is like. So, Carly, if you would, just go ahead and go face down, and we will begin. So, we like to look at different inequalities of the body, and sometimes the feet and ankles is a good way to see if there's any type of compensations going on. And then we want to check the joint motion of the different joints that we may or may not be adjusting. Okay, right here. Go ahead and take a deep breath in for me, Carly. And breathe out. Crunch. Okay, go ahead and drop your arms down for me. Try to get another one here. Go ahead and breathe in. And breathe out. Crunch. Good. Go ahead and go on your side, this side facing up. Good. I'm going to straighten that leg and that one. Turn this way. And take your arm right there. Good. Other side up.
Hopefully good.
And now do this one. Okay, good. Okay, face up for me. And we'll give that anterior shot. Scoot down the table just a little bit for me, Carla. And then big hug. Just like that. Good. And then tuck your chin to your chest for me. I'm going to come underneath here. There we go. And one more time. There it is. Good. And last but not least, we'll check the neck.
Do you want to scooch out?
No, you're good where you're at. Okay. Now there's something on the right side. Oop. There we go. And here. There it is. Ooh.